What we'll do instead is we'll get the CEO to talk to the recruitment slides, and then we'll go to Margaret. Okay.
Apologies, everybody, but it's just trying to accommodate people with different pressures, and we just have an issue with the bandwidth at the moment, but that's okay. So what we're showing people here, or what we want to talk to, is just the growth in staffing and the increase in the work that has happened for us since 2014 all the way to 2021. And in those years, we've seen a WT increase of 1,971 new staff. That's 64% increase in our headcount. So that is impressive in the sense that over those years, we have come out of a very recessionary time from a very low staffing base, and we were working towards staffing our new beds, our new infrastructure, but equally dealing with single-handed services and trying to increase workforce in particular areas, which you'll see there on the screen, even with the health and social care professionals. They've come from a very low base, and we're trying to grow them further. So equally in the realm of nursing and general support, you'll see a very large growth as well in staffing, and again that is to service our new beds and our new developments. So it's good to see the upward trajectory, and I'm hoping that it will stay growing over the next year or so as well, so that we really have a very strong workforce in the region. And we do know, and notwithstanding, that staff do leave and exit the hospital for many good reasons, such as promotion or moving to other hospitals to work, or indeed moving now to what we're seeing to the community healthcare organisations to work on the enhanced community care programme. And in the end, all of those staff will be under one system anyway, the regional health areas. So it's good to keep the staff in the region if we can. Okay, so again, this graph again is just going from December 2020 all the way to December 2021, so it's a smaller year, and in that year we hired 537 WTE and 11% growth in staff, and working through it, our staff are onboarding now, and we also have had 32 new consultants approved, and we're in a very busy period of interviewing and seeing new consultants start to arrive in the hospital group. Okay. And then of course we've built a lot, and when I say we, of course it's easy to negotiate, well it's not easy, but you negotiate funding and developments and all of the rest, but it's your good selves that actually make it happen, and you should be so proud of all the facilities that you're responsible for opening and setting up. And you can see there in the slides all of the numbers of staff that were hired to service these new areas, with the biggest to the 60-bed unit, or 60 to the 8 block as we call it, with 150 staff hired into it successfully. So that's a very nice graph to see. And then the recruitment, of course, we have to acknowledge the recruitment department and medical manpower within the HR departments who have a huge burden of work to do. And it looks very easy, but of course, they offer an interview is the first part, but indeed there's contracting and onboarding and an awful lot of work that has to be done around campaigns and getting people actually to hit the ground running as staff. So you can see what they've recruited, it's significant in the blue area, and then what they're doing around clearance and campaigns underway, which is smaller. But I really must congratulate them on the work they've done. And then the winter plan, of course, we get money each year around winter planning and how do we deal with that. And we've been successful enough in getting significant funding to assist with flow and the recruitment. Again, it tells the story there that we are ranked third in the country with over 71% of staff recruited that we were asked to recruit and were funded to recruit. That's not insignificant. It's really important to us because, of course, our funding will be lost if we don't use it. So to recruit fast and get the staff in is really an important task, and it's good to see it. There's testimonials here then from staff that you can see from Maria and Michael, who are giving testimonials just around their experience and how they feel about working here with us and the environment that they enjoy, and it's very nice to read them actually. Again, a lovely one from Dr. Antonella Milos, our new consultant in infectious diseases, who's arrived here, and we're delighted that she's joined us, and she's talking about all of her colleagues and support in the atmosphere she came into and is working in. So we're very grateful to her for that feedback. Okay. Another slide, okay. So the recruitment initiatives and developments then, of course, they've delivered, and you can see it all listed out there, the various campaigns, and key there is you can see what campaigns are currently available on the websites, and indeed you can contact recruitment if you know staff, colleagues, friends who'd like to come and work in the Midwest, who are living abroad, especially in the UK, who are now looking to come home, to point them in the right direction so that we can bring them in, nurture them and make them part of our hospital group. Okay. And I hadn't seen those slides before, so I think I did a great job. Okay. On behalf of the DHR, of course.
Thank you, CEO. Thank you.
Great. And now the next presentation now is from Margaret on safer staffing.
Okay, so I'm just going to talk to you briefly about the safer staffing framework. So it evolved about in 2015, 2016, the Department of Health commissioned a task force to look at a framework for safer staffing and skill mix at that point in time on general and specialist medical and surgical care settings. And they were tasked with providing key information to determine a safer nursing, staffing and skill mix framework. That was commissioned following a number of high-profile health inquiry reports. One of them was the Big Staffordshire Report in 2013. Another one was the Higuertala Hospital Report in 2012B. And these reports linked nursing resources to adverse patient outcomes. There was a body of research associated to that, and at that point in time, that research was also referenced. So that's where it evolved from. So in terms of, where we are at this point, so following the setup of the task force and all of the research and everything, and I happened to be involved in it at that point in time myself, then the document was published with regard to the framework for safer staffing. A pilot was rolled out in a Model 4 hospital, a Model 3 hospital and a Model 2 hospital across the country. And following the success of that pilot and all the research and evidence that came out of that, funding was made available to roll out the safer staffing to a number of the Model 4 hospitals. We started, we became involved in that, the UL Hospitals Group, only last year in 2021. And we were advised that there was some funding coming our way. So we set up a local implementation group. We have a safer staffing coordinator, and subsequently then through our local implementation group, we put business cases forward to the National Cost and Numbers subgroup for consideration. We are in the process of implementing the safer staffing framework on 5 medical wards and 5 peri-op wards. And how it was determined what wards to start with was based on the senior most management team consulting with the CNM2s and the coordinator to see where we would start. So we've been very, very successful in that whole piece of work. We are at this point, have almost completed the recruitment of the nursing. Off the top of my head, I think it was about 48 nurses that we had to recruit. We're short about 3 at this point, but they'll be in place in the next coming weeks. And we're working through the healthcare assistants. They've been a little bit slower. I think we've got 14 more to put in place, but we'll have those in place in a very short period of time. A very active recruitment campaign is going on with regard to healthcare assistants. So it has been acknowledged nationally that we've done really, really well in terms of, applying for and, they've been believing in the ability that we could do this and then getting the funding. So we've done really well with 10 wards. The uplift was 48 nursing WTs, 28.5, which were agency conversion, and healthcare assistants 29.5 WT, 23.5, which were agency conversion. So the agency conversion was calculated from the level of agency usage on a one-to-one special for each department on an average of a 12-month period. So that was a huge amount of staff to recruit. And we have to do it quite timely in terms of making sure, because if we don't recruit, then we cannot apply for more funding. So really well done. I know the CEO referenced it earlier on in terms of the HR department, but we are grateful to them for all of their support and the nursing manpower office. Okay, so in terms of the benefits for safer staffing, I mean, it is well acknowledged, and the research shows that it does improve the staffing and skill mix on the wards, and it's at a ratio of 20-20. What it does provide also in terms for is that the assurance that we have the highest level of staffing on the wards that will also assure us that we can provide the highest level of quality and safe patient care. So that's really a very important piece for us. It has also been researched and approved that it does reduce absenteeism. It allows us to fill vacant posts through recruitment. There's a reduction in the use of agency. It increases staff development for specialist areas. And 23.5% is built in when we are calculating the uplift on the wards to account for maternity leave, sick leave, annual leave, and so on and so forth. And that makes it much easier for the CNM2 to try and manage her rosters and build in all that piece of work. And it does increase staff morale, staff satisfaction. Our CNM2s are now in the supervisory position, which helps them to manage the ward better, that they're not holding a complement of patients. And you can see the rest of the benefits there. So in terms of, I'll go into the testimonies in a minute, but just in terms of the next steps, so we have 10 wards completed. We have another 10 to complete. Some of them probably won't fit into the safer staffing framework because they're staffed on different levels in terms of maybe the stroke ward and that. But our next intention is that once we have recruited all those staff, which we'll do very quickly, then we're going straight back to the drawing board, doing our business cases again, submitting them nationally to the cost and number subgroup with the intention of getting the remaining wards completed. And that's a really positive piece. Some of the testimonials that have come back from, and you can read them there, one is from Lisa Creamer at CNM2 in Ward 2C. Her comment is overall the ward is much safer and running better as patient tasks are getting done in a more timely manner. And there are other ones there that you can read in your own time, but that is really positive feedback in terms of that. So that's where we are at the moment. There is also, they're now ready to roll out nationally the safer staffing framework for the ED departments. So obviously, and I've discussed it with the CLB executive, we will be putting our hand up and hopefully we will become part of that again as the year rolls on. Thank you very much.
Okay, thanks, Margaret. And our final presentation for today is from Suzanne Dunne, our Prof strategy.
Thanks very much, Mike. So just to remind everyone that our patient is at the centre of everything that we do, and we're working together caring for the patients at the Midwest. And under our strategic plan, we had 4 key strategic priorities, which were clinical transformation, digital health, education, research and innovation, and collaboration and alliances. And these are only possible if they're enabled by our people and culture, our operational excellence and financial sustainability. So you'll see those boards, as you know, all over the hospital. So I'm just going to give you a snapshot of a couple of key projects under each pillar in the interest of the time frame today. And we are completing a robust report on the strategy update, which we will share with people in the coming weeks. So under clinical transformation, one of the key projects was the development of the molecular lab. And this has ensured the highest standards of practice to prevent decontamination of samples. It's allowed for 50% greater increase in COVID-19 capacity testing. And it has also created whole genome sequencing capacity with the ability to detect variants of concern and also to track COVID-19 outbreaks in a more accurate and timely manner. So well done to all those involved in that project. Another project then is the neonatal extension in the maternity hospital. And this has allowed for additional parent accommodation, a new lactation centre to support breastfeeding, and also a clinical engineering unit, and to support facilities for neonatal nurses and doctors, allied health professionals and administration. And in time, it is hoped that there'll also be dedicated areas for teaching and research. Thank you. So 2 of our key areas for development in our strategy under clinical transformation or integration, that was one of them. And so some examples of integration that have been achieved is around the IPOP, which is our integrated care for older persons in the community. And it's really looking at the quality of life for older people by providing access to integrated care and supporting, their needs and giving them choices in their own care. And this has also helped to reduce length of stay and allow these patients to live well in their own homes and communities. So another good project was the stroke early supported discharge. And with the help of a 6-week multidisciplinary team of occupational therapists, speech therapists and language therapists, and also physiotherapists. And they go into these patients' homes, and they have allowed for earlier discharge for these cohort of patients as well. And the clinical recovery and support units have been set up in Nina and St John's Hospital, and again, we're dedicated to adult health staff. So another project that's just about to start is the Sub-Fertility Hub in Nina Hospital, and that's with the support and guidance of NWIP, which is the National Women and Infants Health Programme. And this is a great development in terms of women's health in the Midwest, and it's a great one that we can build on in future strategies as well. So one of the really key points, I suppose, of integration that have worked very well as well is the COVID-19 vaccination centres, and also this incorporates the flu vaccine. And as you all know, they collectively reached 500,000 vaccines a couple of weeks ago. And for our flu vaccination campaign, we have 51% of our staff vaccinated to date in the hospitals and the community. And so we've really paved a lot of great relations for working forward into launch care with our CHO colleagues in this area. Okay, so under digital health, we have just, a lot of you will know in ULHG that we've just launched last week a pilot in relation to bed cleaning. So this was a homegrown project, and we had a meeting on it yesterday, and much to the delight of all, everyone has agreed it's well worth progressing for the next few weeks of the pilot, and can already see the benefits of it, and any challenges we will continue to work through with people. The Limerick Digital Cancer Centre, that has was launched in September 2021, and it's a multidisciplinary research initiative which is dedicated to improving our understanding of biology of cancer and to find better ways of preventing, diagnosing and treating cancer. It will also allow us to subsequently use this data to foster new understanding of the disease mechanisms of cancer. So great things ahead for that project as well. So our next pillar is under education, research and innovation. And one of the key things that we set out to do a few years back was to set up a Health Sciences Academy. And Professor Paul Burke and Miriam McCarthy, the Health Sciences Academy manager, have done that very well. And one of the key projects that have been developed is the Junior Health Sciences Academy. And that is the collaboration with UL, ourselves in the hospital group, Limerick and Clare Education and Training, and our CHO colleagues as well. And the aim of this is that really to provide really good advice and guidance for careers ahead in many disciplines in the hospital, and also for health promotion and leadership as well. So in relation to Allied Health Forum, then the partnerships that have come about between UL and the Midwest community as well, and the disability services. So this is to provide strategic direction for the placement of adult health students, and it creates an opportunity for greater involvement in education and research. And so under our next innovative project, we talked about developing a robotic surgery program, and that has been successfully implemented. So far we have over 250 cases completed. The Sylvester O'Halloran Symposium, run by Professor Coffey, has actually got robotic courses which are facilitated by Conan Pierce. And we also are now a designated centre for robotics, which was always in our strategy. And this week alone, Ms. Osman Mahmood has completed 3 robotic hysterectomy cases in one day, which is a huge achievement. The one patient went home on that first day, and the other 2 patients went home the following day. So great progress in robotic surgery as well. Okay, so under collaboration and alliances, this is where our Chief Operations Officer has collaborated with public services working together on many forums. And this is around, one particular project is Pathways for Prisoners, which is a collaborative with the prison service inspectors to develop a policy regarding the care and management of prisoners attending hospitals. So that's in progress at the moment. And another one is the National Paediatric Network, which is a collaborative engagement with National Paediatrics to provide expert orthopaedic paediatric support as a satellite centre of excellence for Children's Hospital Ireland. So under our people and culture, and the CEO has given you a great update, and the DHR on all of the recruitment. So I just want to focus really on you as our staff and how important our health and wellbeing is, particularly over the last 2 years of what everyone has been through. And so we have a lot of healthy Ireland initiatives, And in the staff centre, Health and Wellbeing Centre, which recently opened, and I know many of you have availed, but we have over 100 staff who've joined our Operation Transformation classes. You can still join if you wish. We have fitness and Pilates and self-defence classes. We've just purchased 10 spinning bikes, and we're going to be running spinning classes there in the next couple of weeks. And you can also avail of quit smoking programs, and there's free nicotine replacement therapy for staff at the moment with that as well. 3 hospitals have received the Healthy Eating Awards, and we're going to be bringing in Tato Park here to do some subsidised staff tickets. So we all know you need some downtime with your families on days off, so we're going to subsidise some tickets for Tato Park as well, so watch out for that. And the Marathon Step Challenge, we'll be working with Limerick City and County Council on that as well, so join in. So under operational excellence, one of just a key project as well was the development of the medical equipment library in UHL, and also operational services. Ireland Crotty and Nivo Brady together have developed a lot of work in relation to this area over the last few years. And Eileen presented this slide, which is a really good synopsis of all the work that the Operational Services Director do in our hospitals, with almost 400,000 dinners. Very interestingly, the maintenance out of hours is at nearly 2,000 calls in 2021. And again, the portering and dispatch is 161,000 in terms of the work that they've expedited. So I just say congratulations to all of you. It's a fantastic achievement across our hospital group. So under financial sustainability, just our Chief Financial Officer has a huge remit around the finances. And so some of the key projects under financial sustainability are the activity-based funding, and that's continuing to be rolled out and reporting available monthly to the directorates. The procurement compliance in relation to improvement structures and compliance, and the national procurement you will hospitals work with to build an online platform for monitoring and procurement of compliance KPIs, and the rolling out of the corporate procurement plan. Also, the National Treatment Purchase Fund and Winter Programme initiatives are ongoing, and the enhanced financial reporting, which the CFO provides to the executive management team on an ongoing basis. So a lot of work done by our finance team as well. So we will be in touch with an updated progress on all of our projects, and thanks to all of you for all of your work in implementing them.
Okay, that's great. Thanks very much, Suzanne. Thanks to everybody who's made a presentation today.